Hello and welcome. We are here today to talk about the importance of risk and informed consent in the fertility space. My name is Mary Ellen Kocher, and I am with EngagedMD. And not only do I work in the fertility space every day, I am also a very proud IVF mom. I am joined today by Dr. Stephen Katz. Dr. Katz is the CEO and founder of REI Protect Group, which is the largest risk management program and provider of professional liability coverage in the U.S. fertility space. Hi, Dr. Katz.
Good morning, Mary Ellen. Thanks for having me.
Thanks for joining me. So to start us off, Dr. Katz, could you please define risk mitigation, and informed consent?
I'd be happy to. I think for the purposes of today, risk is really the exposure to danger. And I would think about risk mitigation as proactive planning to decrease this exposure to danger. And then lastly, which we're really going to focus on today, informed consent, I would really define as bilateral or both parties understanding and accepting of this exposure to danger.
Excellent. Thank you for that. As you had said, risk being the exposure to danger. Is it me, or is there just a lot more risk in the fertility space right now?
And I think there's a lot more risk. When I give lectures to REIs, I often ask the audience, do you feel more risk today than yesterday or a couple of years ago? And it's almost always unanimous. People are feeling a very heightened sense of risk. I think there's two reasons. The first is there's an increasing number of procedures being performed in the lab. Not just cases, but procedures related to those cases. And so when there are more procedures in the lab, there's always a sense of heightened risk. But the second reason I think is equally important, and that I would define it as misaligned patient expectations. It appears to me as we risk manage the national space that patients believe that their IVF cycle should go perfectly. Mm-hmm. And they're sort of prepped in their own mind for perfection. And medical care is not perfect, and sadly will never be perfect. So I think as we talk about informed consent today, informed consent can actually help realign patient expectations away from the concept that their IVF cycle should be perfect.
Excellent. So one of the reasons we wanted to chat today was because of some of the recent lawsuits that have made it into the media. Definitely more risk, always there, but there have been some more pronounced headlines around some genetic testing lawsuits. We aren't here today to discuss the validity of PGT or the class action lawsuit, but I'd love your perspective on what are the takeaways from the information that is out there in regard to the lawsuits.
You know, Mary Ellen, there's been a number of lawsuits in the past couple of years in the public venue. Most recently is this early stage or potential class action lawsuit focused on the genetic testing laboratories. The idea that they did not disclose that the error in this testing platform may be higher than they led patients to believe. In essence, what I think plaintiff counsel may be saying is there wasn't enough informed consent given surrounding the accuracy rate of these genetic testing assays. And I think that's probably the take-home message across the board in many of these lawsuits that are in the public venue. certainly there can be and there are pure errors made in the IVF laboratory, but many, and I mean many of the lawsuits in the public venue surround misaligned patient expectations, that they had expectations that were not met, either through lack of cycle success or things that can happen on a regular basis in the IVF lab in particular. So I think the message here for all of us is really the importance, refocusing on informed consent, because informed consent builds patient trust, as we'll talk about, and that helps prevent claims, and better said, is good risk management.
In your view, what does a good informed consent process look like in a clinic?
Well, I think a really good informed consent process is first education, and second, patient understanding. I think informed consent must be clear. It must really help the patient identify the options that they have, the risks of these options, and the alternatives. One alternative is to do nothing. We all shouldn't forget that. Patients are coming in for information, and maybe the best option is actually to do nothing. So I think a really solid informed consent platform focuses on education, clarity to the patient, and patient understanding.
And that is the definition of what you think it looks like. How would we get there?
I think years ago, informed consent was really focused on the clinic passing out what I would call the paper informed consent. Here's a packet of paper. Please look through it and let us know if you have any questions. Well, I don't think that works. First of all, I think that patient information packet really was focused on the history of IVF. The field is new. How did we get here? Why is this likely to work? And I think we need to move beyond that. We need to talk about options, risks, and alternatives. When you create a packet of paper that's so thick that focuses on the history of IVF, it misleads the patient away from options, risks, and alternatives. So I think, one of the great things EngagedMD has done has brought the informed consent process online, so that patients in the privacy of their home or their office can really get to understand their options, risks, alternatives. But also, we have the ability through the EngagedMD process to ask them a few questions so that they're signing off on their understanding. I think it's also provocative. I think it allows them to write down questions that they may have to have a continuing dialogue with their provider care team on this informed consent. So what does, modern informed consent look like? I think it's a continuing process of information flow, creating an understanding for the patient, which ultimately will create trust between the patient and the clinical team.
Excellent. Thank you. Thank you for calling out EngagedMD. As you said, we create clear, concise videos for people to learn about fertility, their treatment plans, etc., in the privacy of their home. And as you had noted, we have the opportunity to ask them questions at the end to make sure that they understand that information before they sign their consent. It really is the base level of EngagedMD. Some of the clinics I'm working with now have taken it to one extra level. So we now have the opportunity to take an education module and block that consent form until the education model is reviewed and all of those questions are answered. And so, for example, we have clinics that have a PGT module and they have an embryo biopsy consent form, and the patient cannot unlock that consent form until they view the entire module. So really taking that informed consent and applying best practice so that we have risk mitigation at the highest level.
It's really powerful. I mean, that's why we're here this morning. And I think it's a great tool to build trust between the patient and the practice.
Excellent. Thank you. Any other thoughts about informed consent, both from the patient side in terms of it being a meaningful opportunity to understand information and consent to it, as well as the clinical practice in terms of protecting themselves?
I think informed consent, Mary Ellen, starts at the first patient visit, whether it's in person or by telemedicine. As the provider discusses the clinical history and the options, we're really beginning the informed consent process. It's the cornerstone of patient autonomy and how a patient would make their own decision about their own medical care. So I say that because I think everybody knows that, but we don't really think about that. But informed consent really starts at the initial visit. And then it takes a more formal approach, either through paper consents or hopefully online consenting, so that the patient really understands their options, their risks, their alternatives, and ultimately, we hope, sort of proves that understanding by answering a few questions and having that documented. I think that's, as I just said, really patient autonomy. From a risk mitigation or risk management perspective, the informed consent should align patient expectations. I think it really decreases the concept that a patient thinks their IVF cycle should go perfectly. So aligning patient expectations with the clinic builds trust. And so I think the final point is that trust between the patient and the provider clinic is the number one risk mitigator in modern medicine.
Excellent point. Excellent point. Thank you. For those who are interested, we do have an informed consent toolkit at the end of this video. Dr. Katz, thank you so much for your expertise and joining me today. I appreciate your time.
My pleasure, Mary Ellen. I hope this was helpful. It's near and dear to my heart.
Thank you. You can tell. Thank you.